Hello class, welcome to week 3. My name is Annabella Zempero. This is my current event presentation. The article I decided to discuss is called Cases of Vaping Related Lung Illness Surge Health Officials Say. It's written by Matt Richtel and Denise Grady. It was published in the New York Times, September 6 of 2019. Recently, we have been seeing a lot of cases, especially teenagers, ending up at the hospital just because of vaping. Federal health officials are warning the public about the danger of vaping. At least there are 450 possible cases in 33 states and 5 deaths. As the article says, there is clearly an epidemic that begs for an urgent response. Dr. Critiani wrote an editorial where he suggests doctors to discourage their patients from e-cigarettes. Also, to bring public awareness about the effects of vaping. Probably you know what vaping is, but for those who don't, it is called vaping because it comes from a power device called e-cigarette. It heats a liquid into a vapor that can be inhaled. The vapor can contain nicotine, flavoring, and other chemicals. They can also have marijuana, hash oil, and other substances. This device was created to help quit those who smoke cigarettes on a daily basis, like a pack a day, but instead it attracted young people who had never smoked. A very popular e-cigarette brand is called Juul. Vaping is referred more as a getaway drug. Investigations are ongoing by the Center of Disease Control, and they suggested that people should consider not using these products at all. In 2018, the federal government sponsored a survey that found that 20% of high school seniors had vaped within a previous of 30 days compared to 11% of the year earlier. The main issue is that we do not know what the substance is causing the damage. What looked like a scattered cases earlier this summer has become a full-fledged and widespreading public health scare, leaving otherwise healthy teenagers and young adults severely ill. The article states that the public health officials have underscored one fundamental point, that the surge in illness is a new phenomenon and not merely a recognition of a syndrome that may have been developing for years. But the FDA not seems to be getting that involved in this situation. The American Academy of the Pediatrics is equally worried and urges the FDA to do more. The AAP said that the AAP rejects FDA's decision to allow 5 leading e-cigarette manufacturers to submit plans in 60 days for how they will address use of their products. FDA has the ability to do what the tobacco companies can't and won't do: take effective steps to reduce and eliminate use of e-cigarettes. Also, the AAP has joined other leading health and medical groups in legal action to compel FDA to do just that. If FDA continues to delay meaningful regulations, a generation of young people will become addicted to those dangerous products, which are being marketed to them as appealing, child-friendly flavors. If FDA is not putting that much emphasis in this situation, healthcare system keeps leading us down. Since it is a threat to the population, we need to try to look for how to help our community and to stop future cases. The community defines the hospital that we work, and if there is a situation that is affecting those in the community, well, it will also affect the hospital and insurance companies who are trying to deal with the situation. We're trying to look for the best pathway to solve the issue that a public healthcare crisis might bring. The way the hospital identifies patients and how to properly treat them. Also, maybe hospitals might need more pulmonologist specialists with the ongoing crisis. Further investigation should be conducted in order to stop this from getting worse. Thank you for listening to my presentation. I hope you enjoyed it.